just so you know, there's 3 levels here. Number 1 is that we do have about 1.5 million test kits going out as we speak to hospitals, particularly hospitals in areas that have seen coronavirus cases. In addition to that, thanks to the good work of the FDA and the change that President Trump authorized this weekend, now every state health lab and university lab can conduct a coronavirus test, and that expands the capacity. But ultimately, as Dr. Birx will explain, our objective is, in addition to those tests being available, we want to get to a place where any American who has a concern is able to go to their doctor, is able to go to a medical clinic and know that there's a coronavirus available. We think we can get there in a matter of weeks, and in partnership with the commercial labs, we're challenging them to do just that.
Medical conditions, or you're of the elderly and frail. What we've heard from CMS and from HHS, that this will be an essential lab test, so fully reimbursable. What we talked about with the commercial laboratories is exactly your question. And we asked them, and they're in validation this week, some of them thought they would have tests available on Friday and the rest on Monday. I've asked them to prioritize the areas where we've had these clusters so that people can be reassured in those areas where we have identified virus has been circulating. In those cases, they will have it available at doctor's office and all of our pediatric offices that would need it, and they will transport it through a logistics network to make sure that they can be run.
On that very closely and follow the cases.
So this is something that's
HHS has designated the coronavirus test as an essential health benefit. That means, by definition, it's covered in the private health insurance of every American, as well as covered by Medicare and Medicaid. And but we're working with members of Congress, and we'll be monitoring the cost very carefully. Please.
what travel restrictions on Italy and South Korea are you considering?
Have the support, that we come alongside them, that they have the personal protective equipment and gear to be able to minister to anyone.